Last week I lost my brother, who was a doctor, and he was serving homeless patients and people extremely under poverty. He was helping those people.
This is in India, right?
This is in India, in Delhi. He passed away due to the shortage of beds and oxygen in the hospitals. Mismanagement of essential needs has taken his life. The government there is in denial and even is blocking the social media in these issues. Now, the growing crisis in India is like our Australians are there, and then we are worried about them, how to bring them back here. With the conditions they're worsening, the crisis they're growing, I'm worried about our Australian fellows and trying to get them home back to Australia. All I want to know is, why is the Australian government not doing anything in bringing them back? I had some answers from you, but still not very satisfying.
Before we go to them, I'm really sorry to hear of your loss. Your brother was a doctor working with some of the hardest
patients
hit by this.
Night after night, he used to go to the places where these homeless people are, and he used to visit individually. And he was working in COVID clinic where he got the...
And what's it like for you watching this from afar, seeing all of this unfold?
Yes.
Having it touch your family?
It's very devastating, and it's very heartbreaking, and it's like, I just can't explain.
Parnell?
Very sad.
I'm so sorry.
I don't want, like, my Australian fellows, not to go under all these situations, and they should be brought home as soon as possible, because the crises are growing. We don't know what's... And they say that peak is not come yet.
No.
Peak has...
Yeah.
Yet.
So it's going to get worse. Parnell?
I'm so sorry to hear about your brother. And I agree. I think we need to bring people home as quickly as we can. I think it's so important for the Australian government to say, these are our residents, these are our citizens, and they're in trouble, and we need to help them come home. And I think it's devastating that flights have been cut rather than increased lately, partly because hotel quarantine has been so effective here that we actually could say we can bring people in. Our hotels at the moment are at 50% occupancy. There is no reason why a city like New South Wales, which has handled hotel quarantine very well, couldn't take in those people. Why other states couldn't copy that hotel quarantine approach and also take people. I'm glad that they're bringing Howard Springs online. I'm glad that there are other facilities being built. But we have facilities right now who can help people, and they need to be helped.
But this is also a decision about cutting off flights, right?
Right, and which is just unconscionable. I mean, so they're flying supplies to make vaccine and to provide oxygen to India, and the planes are coming back empty. They need to be coming back filled with people. They need to be coming back filled with people who need help, who can be put in facilities which exist right now and treated. And why we are not doing that is politics. It's down to pure politics. And I frankly don't care whether this is politics at a state level or politics at a federal level. They've got to stop playing politics and sort this out, because this is the Australian citizens. They have a right to come home and they need our help.
Doesn't the federal government, Bridget, have to stop? Doesn't the federal government have to stop pointing the finger at the states and find a way to get these people home?
Well, I think there's a couple of issues, and I just want to say deepest sympathies to you and your broader family. I think we're all watching what's happening in India with great concern, and it's a tragedy, and that's not just if you're from the Indian community. Your brother was on the front line. We're not just sending oxygen, we're sending PPE, we're sending ventilators, we're sending a whole lot of practical support on the ground to help India through this crisis. We're also obviously going to remove this temporary ban as soon as possible, and the Prime Minister's made that very, very clear.
But why are these planes going and coming back empty?
It was
Why are they coming back
actually
empty?
instigated on medical advice, and it's not the first time we've put a temporary ban on flights as a nation. This is a very high-risk area, and the government's made that decision based on medical advice. We can't sort of say it's okay to take the medical advice in some examples and not in others.
But we didn't make
so we're
those
being
bans.
consistent, and I hope that come May the 15th, we can actually get people on planes and get them home and get them into the expanded facilities at Howard Springs so that we can do exactly what we all want, is get those citizens home safely.
We didn't make those bans when there were similar numbers in the UK and the US. That's the peculiar thing, is that we've seen these high figures in these countries before and we haven't banned travel to Australia. So,
well, there's a number of examples where we have, and we take the advice of our medical professionals, as we should.
Hervé, do you think the Australian government has an obligation to be doing more immediately to actually get these Australian nationals home?
Yeah, look, I think it's a tough call, not an easy judgment to make. I can see the arguments on both sides, but I would have gone the other way. I think we have a humanitarian responsibility here towards our citizens, towards permanent residents abroad. And we could have, I think, we're sometimes a little bit too precious in the way that we see our responsibilities in what is really a global pandemic, a global disaster. I'm also similarly frustrated, on the one hand, in awe of the achievements that Australia has created in terms of the setting up what was, at the time, the most effective quarantine system in the world. It was a real policy innovation, but we haven't seen much innovation since then. And we haven't seen the capacity to surge when we have emergencies like this. So I would look at this from the perspective of those involved, those stranded abroad, also those within the system, because it takes a huge emotional, physical, financial toll on them. And I think we can also free up capacity by perhaps having another look at some green lists. Which countries offer the lowest risks to us? Could we, for example, institute something that the UK has experimented with, and it seems to have implemented that rather effectively in the last few weeks, which is the first 10 days in hotel quarantine, followed by 2 tests. If you're still negative, you finish your quarantine from home.
But we've got to get the state premiers to agree to this. This is the problem. Like, we've got some premiers that are happy to take the heavy lifting, like the New South Wales Premier, and we've got other premiers shutting their whole state down for one case.
But Victoria's proposed quarantine facility. Do you support that?
Well, I would propose that actually is either an admission that their own system has failed. We had over 800 Victorians die as a result of the mismanagement of the quarantine system.
Just want to be clear, though, do you support this proposal or not?
No, I would support. We've got empty hotels ready and waiting to be filled with Australians coming home
hotels are
into
not
Melbourne.
long-term
I'm sorry,
solution.
you can actually
The
run
AMA
this system,
says that.
Mark.
Every expert
it's
says that.
99.9% effective.
Hotels are not a long-term solution.
The stats bear it out.
They're not a long-term solution. Every expert has said that, including the advisors to the federal government. And I think until we get a range of those large quarantine facilities scattered around the country, we can't just rely upon one in the Northern Territory.
So
we're going to
how many would
continue to
Labor
have these
have?
hotel outbreaks.
If you were in charge, how many would you have? How many
Well,
national
certainly I would be thinking about them in the major states. And look, I don't have the planning resources available to me, but that's what we've done in the past. The Commonwealth has run quarantine facilities in all major states for decades upon decades. Can I just agree with Bridget, though, that the decision taken to pause flights from India was taken on medical advice. Now, I wish we had better quarantine facilities in place and did not have to take that decision, but we are where we are.
But the medical advice is...
The scale of the crisis in India is jaw-droppingly bad. Like, it is jaw-droppingly bad. So we do need to make that period work, build something that allows us to get back the 9,000 people who are wanting to come home from India, but recognise also that that's only one small part of the crisis.
Just want to bring in Amar Singh, who represents Turbans for Australia, which is an incredible charity organisation and community group. How many people have you heard from today, or groups of people have you heard from today wanting to get people back from India?
But I've been working with people for the last 12 months trying to get back home. So it's not just today.
Yeah, but just this morning, what was the number of calls you got?
Oh, mate, I can count it in hundreds in the last week, messages, WhatsApp, people saying, can you please help us with this is a petition, these are the videos, what can we do? I mean, I'm a small community leader, if I can call myself that, but people look after me and say, can you please raise these issues? These people have no voice. They're stuck. They're Australians. And we urge the government to help them.
And what are you getting from the government when you reflect these views?
Pretty much nothing to say, we haven't had any answers. I mean, we should have done more when the quarantine, the COVID was better here in Australia. And these people deserve to be home. You've got young people separated from their parents. People are suffering financially, mentally. Relationships are at stake. Young kids don't want to talk to their parents because they're not coming home. And what do you tell a 5-year-old saying, I see planes every day, why is my dad coming home? So a lot of people are suffering and they have no way of getting here. Financial constraint of people. I know many people who've jumped onto flights or agents trying to book a flight back home and they're losing money left, right and centre.
And am I right in saying that there's some fear amongst the Australian Indian community about speaking out publicly about this stuff? People with visa situations are concerned that if they go public. Why is that?
Because there's many things. I mean, we come from a third world country. Let's be open about it. I've been here 20 years, but I know how the system works there. Even I could be picked up. I mean, Twitter has been asked to take down anti-government posts in India. So people are fearful because they live in that system now. The police could be harassing them or their families. And this is how the nature of the thing works.
Parnell, do you have a view as to how the government should be responding differently to people like those Amar is describing?
Well, as I say, I think we should be bringing people back. I think that the entire attitude that we can eliminate risk entirely, whether it's coming from health professionals or from politicians, it is just wrong-headed. We can never eliminate risk entirely. And we have been trying, for some reason, instead of flattening the curve, we ended up with this complete elimination strategy, which is not going to work long-term. Doesn't matter how many quarantine facilities we have in Howard Springs and anywhere else around the country. Risk is not going to go away. So we need to start figuring out how we can deal with situations like this, respond to them in a humanitarian way, but also accept the fact that life is going to have to go on and we are never going to be completely risk-free. And if that means politicians biting the bullet and understanding that they have to start taking some leadership rather than hiding behind health professionals, then I say so be it.